All right, let's start with some quick stats. I know your name. I know it's Erica, but you want to say your name, where you're from, what you do.
I am Aeryka Harvey. Um, I do a lot of things.
That's
uh,
right.
I do a whole lot of things. But I'm a girl who was born and raised in the Seventh Ward of New Orleans, but grew up there and in Jackson, Mississippi. So she's well traveled too, lived a few places. Um, when I say I do so many things, I really do a lot of things. I do in the medical space. I've gone through medical school, completed residency as well. I've taken board, so just waiting on those results. I also am a doula. I also am um, currently building a family care agency that specializes in postpartum support and nanny services.
Mhm.
Um, I'm a mom, I'm a wife, I'm a sister, my daughter, I'm a whole lot of things, my friend. I have a lot of pieces here. So I really do have my hands in a lot of things, but my central focus is um, creating a solid continuum of care for Black moms in
Yeah.
this maternal health space.
Okay, so you mentioned that you're a mom too,
Yeah,
and you're talking about this continuum of care.
yeah.
So, from your experience, as a doula and as a mom, what does that look like, and where's the gap? Why is that the focus? How'd
It's
that happen?
such a broad gap because when we think about, like I said, I dwell in both spaces. So being on the physician side, being on the doula side, being on the mom side, experiencing firsthand where there needs to be some type of referral, especially in the postpartum period or even during the pregnancy. But when we talk about, let me go back. I have public health background,
Mhm.
so literally looking at everything as a public health issue, as a public health concern. We have to address the simple gaps. Like if we take the city of Atlanta for example, a lot of people get around with MARTA, right? So we look at when if I live in the greater Atlanta area and I need this referral for a cardiologist, but my cardiologist, the best one, is in Marietta or Kennesaw or Ackworth. How are we gonna get there if I don't have a car? If I'm, in a low income impoverished area, how am I going to get to these care points, these referrals that specialize in my unique situation, right? So when we're talking about creating a continuum of care, it's almost like building a database of people who can kind of meet our moms where they are, meet the families where they are, and grow from there.
I like that. Okay, I'm taking notes. And I like that phrasing, continuum of care as
Mhm.
well. That's not something that I've heard, at
Mhm.
least like my providers use with me. So um I'm just thinking about like how does it all work like cohesively, holistically? How is it all serving my health when I'm looking at my continuum of care?
So it's not just like central you're like one central location or one central person's health picture, their health history. um when you talk about like looking at it from a public health perspective, you're talking about access and equity ultimately, and uh, a little bit of cherry picking
Mhm,
to say
mhm.
like this is my situation, this is what means most to me. So for some people proximity may mean more to them than anything. For some people costs may mean more than anything, or what insurance you take. Is literally about building something where everybody can have access regardless. And does that take does it take time? Yeah.
Yeah.
And we in creating this continuum of care, what you also have to look at is cultural awareness or cultural competence. Um, because when you think about, let's say, in the LGBTQ plus community, there are people who just don't go to the doctor because they don't feel comfortable. They don't know if they will
Mhm.
be affirmed. They don't know if they're going to be judged or not. The anxiety that likely puts you in this situation to need this healthcare provision, it just it rears its head. That
Yeah.
fear, that worry, and you want to help align the public with healthcare providers who can meet them where they are and give them the care and the support that they need.
Hmm.
But I think a lot of times that kind of starts with the back end. Like, who are you seeing now who knows how to match you with this provider or
Okay.
that provider?
Okay. I like how you were talking about that too, about like feeling comfortable, because it reminds me of the directed study that I did where we were talking about how trust is a huge factor in therapeutic adherence. And
Yes.
so it's like, do I feel comfortable with my providers? Do I trust my providers? Am I going to follow through with what it is that they're telling me? Or do I feel like they just kind of,
Mm-hmm. And it
uh-huh.
doesn't just come down to like, yeah, for the Black community, yeah, we want providers that look like us, but we also want to know that, yeah, yes, you look like me, but you also understand a little bit of what I'm going through. You
Hmm.
understand how to meet me in my lived experience and not try to pull me up or into your beliefs or your value system. You can just literally meet me where I am and help me from there.
Yeah. How does that show up in the doula care with helping prioritize what's important?
One of the things I've always started with was a really in-depth consultation. I've always found that the consultations where we talk a good minute, okay, we
Hmm.
can lock in. I can truly meet you where you are. And that's asking a lot of times those really hard questions, like those really intimate questions. Um, and sometimes you have to dance around it. Sometimes you have to ask the question without asking the question, right? So,
Hmm.
like, it starts with a simple intake form. It's not just for me to, have preliminary information and contact information, but there are
Right.
things that I need to know so I can have talking points. So if I say, in the intake form, if I'm asking, is there anything, that happened previously, whether it be with a previous pregnancy or loss or something that could affect the remainder of your pregnancy, wherever you are at this point, and into your postpartum period, what I'm essentially asking are there any traumas? Are there any happenings
Hmm.
previous in life that could affect what this whole terrain will look like?
Hmm.
Um, and it's an optional, it's an optional question. Like, you don't have to answer it. But I found honestly that people are more comfortable with disclosing that information because um, they want to put their best foot forward in
Yeah.
pregnancy, albeit because I think everybody looks at the long term, like I want to be a good parent, and that ultimately starts in the pregnancy and carries over into the postpartum period. But it specifically in the doula space, it just looks like having those intimate conversations and then knowing and also surrounding myself with resources of providers and people who can better serve these people. So I wouldn't just have a resource list of one person per category. So you
Hmm.
have an extensive list of chiropractors or midwives or pelvic floor therapists or mental health therapists and that kind of thing. So to be able to truly match the person with who might best serve them.
Okay, have you ever found like with clients that maybe they answer, maybe they don't answer that question, but you see something that wasn't disclosed popping up in the journey with
Yes,
them?
all the time. And I think just because in this work as a doula and in anything in healthcare where you are of service to people in general,
Hmm.
there has to be a lot of intuitiveness to be able to hear and see what's not being said. Like if for example, if I'm noticing that a client tenses up when something happens when we're in the birthing space, like even something as simple as someone pulling back the blankets if we're in a hospital or in a birthing center or something, or if you respond to a touch a little differently, um, that's my cue to kind of ask, like, what happened, here? Like I notice when this happens, you kind of have this reaction. You know, what's going on? Is that a trigger? Is that, something kind of guiding the conversation in a way to kind of get those answers so we know how to move from then on. At that point, it's not just a nurse, there's someone coming in and just pulling your covers back. It's like, hey, are you ready for this to happen? Are you okay with this? But it not just intuitiveness, you just have to be observant.
Put them glasses on.
Yeah. You do. Like you have to, a lot of birth work is really just, it's truly reading the room.
Mm-hmm.
It's truly reading the room. And that's one of the things why I tell people, I feel like now I really have the verbiage to answer your question. A lot of times what I prefer to do is support people in what I call their support language. It's a lot like your love language.
Mm.
Some people need to be constantly affirmed. They need to hear I'm doing a good job, you're doing great, all those things. Some people don't care anything about your words. Can you just bring me some food when I see you? Some people don't care anything about the food or your words. They just want a hug. People just want a space to be able to talk and dump, which is fine. But to support people in their support language, that means getting to know them, like getting to know them more.
Mm-hmm.
And I feel like as a birth worker, you can't truly do your job effectively and efficiently if you don't know your client.
Mm.
Because you're going into it's already an intimate time, but you're going into a very intimate space with them. And if you're a person who does not need those words of affirmation, because what tends to happen, especially in hospital spaces, the nurses tend to fill the quiet with noise. You're
Yeah.
doing great, mama. You're doing so good. It's like, please
Right.
be quiet. That's not
Yeah.
what she needs. I know you mean well, but as someone who's worked with her and who's learned her over these last few months, you just met her at 7 a.m.
Mm-hmm.
I've known her since 12 weeks.
Yeah.
So to be able to support them in that space is truly me taking the time to get to know you. I enjoy those long conversations. So that way I'm peeking inside your brain, inside your emotions, inside what makes you tick. So when we show up in a birth space, I can understand where your I don't know to a simple question. So it could be something as simple like, do we want to do IV payments or do we want to get an epidural? And your
Mm-hmm.
response is, I don't know, because you went to an appointment on Monday morning and this turned into an induction
Yeah.
because it's out of your control now.
Yeah.
You
Yeah.
just completely disassociate. So I think a lot of being able to truly meet the clients where they are is learning them.
Okay, this also has me thinking like that process of getting to know someone,
Mhm.
of building that relationship, that inherently it takes some time. Yes, there are moments where you can meet somebody and y'all can hit it off and everything, but like is there a like you can't be further along than X many weeks to engage with you as a doula.
And I think that's one of the myths that we have to dispel because everybody's like, you can hire a doula anytime. It's like, yeah, you
Mm-hmm.
can. Sure. But I always say the sooner the better. One of the things that I've dreamed up and truly envisioned is that type of support where you truly can have that for real, like wraparound care, which is why on the medical side, one of the specialties that I'm interested in is reproductive endocrinology and infertility.
Mm-hmm.
Um, I don't think that it's enough to just guide someone through the process of, okay, X, Y, and Z, and then you're pregnant. I
Yeah.
don't think that's the time that you break away and hopefully slide them into the care of someone else. Um, it's truly that continuum. So if there were a program, if there was some type of support service where you could truly have wraparound care from beginning to end,
Yeah.
from preconception, trying to conceive, to conception, through the pregnancy, through the postpartum period. If you're returning to work, day nannies. If you're, need a little boost in the, have a night nanny, that kind of thing. Um, it starts early, but a lot of people just kind of embark on a journey on their own because I think, just my perspective, um, people are just used to being in hermit mode.
Mm.
Um, And so we kind of think that we have to embark on journeys on our own.
Mm.
Ultimately,
Yeah.
creating that continuum of care means reviving community, reviving the village.
You know, I like that phrase.
You gotta revive the community.
Yeah. Yeah.
Um,
Yeah.
and that creates that true wraparound, let me hug you, let
Mhm.
me nurture you, support.
Well, it's like you're an example of how the healthcare provider can
Hmm.
be an asset in reviving community
Hmm.
and not simply service provider. You come in for your appointment, I'll see you.
Yep. Yeah. And especially
Mhm.
when we talk about maternal health in Georgia, but also just in the South in general.
Mhm.
Um, what that care? There's so much division and everything is so divisive as it relates to maternal and reproductive health when it comes to um just how like physicians and midwives intermingle with each other, how doulas and midwives and physicians intermingle with each other. So I sit in a pretty peculiar seat where at any given
Yes.
moment both my worlds are anti each other.
Yes. And not to mention some of like the political changes too, the whole Adriana Smith
Yeah.
scenario. And so it's like, so now working through those laws.
So one of the things that I also just completed, when I say I have my hands on a lot of things, it's a lot of things. So I also just completed a doctorate of public health.
Okay.
Um, my master's of public health, I felt like was really, really good in helping me truly get into these like, maternal fetal health spaces. But I also feel like the doctorate of public health will help me get into more policy making spaces. And initially, I think when people think policy, they think literally arguing with the government all the time. But
Hmm.
I also feel like some of those changes can start at the small scale. Can we change the policy in hospitals first?
Right. Right.
If we can change the hospital and clinic policy, everything else will usually, with a little bit of fight, will fall into place. So let's change small things. Like, why does and I understand for especially since COVID, since the pandemic, I understand, you want to limit, how many immune systems are in a small space.
Okay.
Fine.
Hmm.
That's fair.
Hmm.
But when you talk about there's particular hospitals here in the Atlanta metro that say well, you have to sign this consent form to have your doula present, and if we feel like your doula is being intrusive with your care, we'll have them removed, and we'll encourage you to ask them to be removed, which ultimately signifies that you don't want the doula there in the first place.
Hmm.
Or you have providers who where patients will ask, have you ever worked with a doula before? Have you ever had a patient who had a doula? And this is based on a true story. This particular client told me, yeah, my doctor told me she's okay with working with a doula as long as she stays out of my way.
Hmm.
The scope of practice doesn't mix. So a
Right.
doula wouldn't necessarily be in your way, but help you.
Right.
um, and so for me, it was kind of like, huh, that wasn't a red flag for you. Okay.
Hmm. Hmm.
Right. I think what truly can help is if everybody just kind of sits down, has this, this round table discussion and say, hey, I'm not here to step on toes. I'm just here to help. Because
Right.
when it's all said and done, your OB is only here to catch your baby and leave.
Right.
They only see you once a month. Your doula's here for the long haul. If you go the midwifery route, they're seeing you a little bit more. The care is a little bit different. It's a lot different. Um, but I think there should just be more true sensitivity training when it comes to people who are in a vulnerable space. And it's not just about sensitivity to, race or other family style or whatever.
Right.
It's truly, hey, these are people who are going through a whole lot of emotion and they are literally afraid.
Right.
So maybe be a little bit more gentle
Hmm.
or shift the language. I've heard recently, like in the last few weeks, a lot of providers saying, well, I do this and I'm going to tell you what I'm going to do next. With what?
On my body?
on my body. Okay,
You're gonna do, excuse me? I gotta call. Like,
okay. And I was like, and it was a bit cringy for me. Like, it's kind of sharp. Like,
right.
tell you what, well, typically I don't do this, but I mean, I'm gonna let you have an opinion. Oh, that's different.
Yeah.
So
Like, are we trusting people to communicate about their bodies or not?
but I also feel like it's a lot of people tend to take this like go with the flow kind
Mm,
of attitude when it comes to
hmm
their healthcare. I think because inherently in the Black community, we were just taught like the doctors went to med school, so they know what's best. But the doctors aren't living in your body. So
Right.
if I walk into a patient room, I'm I'm listening to you. I will happily tell a patient, okay, so tell me what's wrong with you. And they kind
Hmm
of look at me like, I don't know. I don't live in your body. I don't live with you. So tell me what we're experiencing.
Right.
What's going on here? How can I help? Listen to me. Let me listen to you. And you can do more diagnosing seriously if you just listen. If you just listen, they'll tell you everything they need to know. It's like, oh, you just needed to vent. That's why your blood pressure's high. Okay, now let's take the blood pressure. Got it. Perfect. It's beautiful now.
I'm like, please stop taking my blood pressure after I hustle and bustle with a
Listen.
bag. I
Yes.
just sat down. Give me the
Yes.
bag. Give me
Let's just
the
take it. Let's just give it a minute.
bag.
Let's get this
Hmm
out. Okay, work is stressing you. Great. Great. Now we can take this blood pressure.
All right. So this is going to bring me to like my business questions for you.
Yes.
So speaking about the continuum of care and the wraparound care
Mhm.
and the reviving community and with your hands in so many
There's
different
so many
things.
things.
How's business? What's next for business? Like, what are you thinking? What are you thinking? How do you
Okay.
serve, and what do you want to do in the future too? That's a
So
big question.
that's a very big question. So I'm at present, like I said, taking a break from like the hamster wheel of the hospital setting,
Hmm
to just relax and be a present mom, be a present wife, be a present aunt, all the things. And I'm restructuring my birth doula business, doing a little bit of rebranding, and super excited about that. But I've also taken on the mammoth task of creating a new one, um, in the same vein, but focusing truly on family care, which specializes in postpartum and nanny services.
hmm
So it's ultimately a family care agency, that once my clients are done with me on the birth side and we do our, initial two postpartum services, our postpartum visits, they can transition to, a new postpartum doula who's there, with them. And then we're essentially creating a family care team. Like you can build your tiers of access. So the night nanny will come a little bit earlier. And then the day nanny can be a situation where, you're returning to work and you just need somebody to come in, part-time or full-time, whatever works for you and your lifestyle. And you feel, that your care is fully vetted and safe. This new business is called Nest and Kinco. And it's it's exactly how it sounds, and it's coming across so far how I want it to land. A lot of people are visiting the website and like, this just feels good. This feels warm. And so wanting to put our best team forward. We have a pretty solid team of fully vetted postpartum doulas, day and night nannies, across all three services. It's over 100 years of experience.
Yeah, yeah,
Over 100 years of experience. They are fully vetted, a lot of experience, a lot of solid support. And soon to come will be the postpartum pick up and drop off laundry service because everybody hates doing their laundry in the postpartum period. So that will be soon come in 2026, just to truly um, provide families with nurturing support. What I envision for Nest and Can is truly Black girl luxury.
mm,
And from the perspective, not like not like the type of luxury that people automatically think of when they hear luxury.
Hmm.
But when we have babies, yes, we are grown women usually. But sometimes when you have a child, you want to be wrapped up and held and nurtured like a little girl. Because yeah, it's great, but we don't know what we're doing. And sometimes you just need that little nudge, that little guidance that it's okay. And even if that means just taking something off your plate, if that means folding a baby's laundry or warming up some food for you or something that just allows you to take the cape off,
Hmm.
that's what I wanted to allow nesting Kin to present.
I like that. You mentioned the hamster wheel of the hospital, and I wanted to ask you,
Mhm.
especially with creating these teams and the experience of creating teams, have you considered the direct primary care model?
Seriously. Eventually, my goal was always to um, have my own. Now I have the verbiage for it. It was always have my own practice. It wasn't until I became a doula that I was like, I want my own birth center. I
Mm-hmm.
want my own like comprehensive women's health center. Um, and further for that, continuum of care. I've always said I wanted to have, of course, I'll be the OB on staff, but I've always wanted to have midwives on staff. I always want to have doulas, chiropractors, pelvic floor therapists, all these people who are very vital in maternal health and reproductive health in one hub, right? Because I hear all the time, oh, my doctor's in Marietta, but I have to go to Conyers for XYZ. And it's like that makes you not even want to go to the doctor
Yeah.
because
Yeah.
your days are so spread out. I want to have like med spa staff in this clinic because yeah, everybody likes to get their nails and I like to get their pedicures. But if you're chronically diabetic or you have gestational diabetes and somebody nicks something, they don't know how to fix that in your normal nail shop.
Right.
They don't know how to care for that. If you have a wound, they don't know how to pedicure around that. So we
Mm-hmm.
need med spa. We need those types of things. We need chiropractors. We need prenatal massages. We need those things. But I really want it to be like a centralized hub where we don't have to worry about, going all several miles away. If you need a referral to a cardiologist in the postpartum period, hey, go down the hall.
Let me tell you something, and I really love how you're phrasing these services like a chiropractor or a masseuse or med spa staff as uh, more integral and
Mhm.
necessary rather than the luxurious,
Mhm.
like spend. Because I think it speaks to like the importance of taking care of your body and like
Yes.
maintaining your health.
Mhm. Yep.
And that's not a flippant task. That
Right.
actually is the task.
Right. And I think part of I don't want to call it an issue, but it is an issue.
Hmm.
Or part of the concern is that everybody wants to do it on their own.
Hmm.
The community starts within the providers. If they don't see us working together, why would they ever feel comfortable leaning
Hmm.
on community? It's truly, I think we've always been like a, sink or swim society, but it's even more than that now because everybody has their own thing going. Um, but I think if we address how real can I be?
Oh, very,
Okay,
very.
because
And look,
we
anything
know
you don't
that.
want to talk about, I'll cut it out. It's okay. Like, yeah.
So everything starts with the women, right? If we're not
Yep.
taking care of the women, all of this to be messed up.
Hello.
So if there's not some type of like central location or central hub where women can truly be cared for and taken care of,
Yep.
everything else is gonna falter. Everything else is gonna go to the wayside. So if we can include these means of care, because the silent killer of women, Black women, is heart disease.
Mm. Mm-hmm.
Yeah, you need a cardiology referral. You need an endocrinology referral in the postpartum period or during your pregnancy. Let's also get your mind together. Can we do pregnancy? Can we do pregnancy therapy? Can we do postpartum therapy?
Hello. Hello. And let me tell you how you were saying it all starts with the women, because it's like if you're not caring for the women, not caring for the women, not being taken care of properly, that is a form of disenfranchisement. That
Yes,
is a form of discrimination. That is a form of like
yes,
taking away your humanity and peeling it back.
yep.
Mm-hmm.
It starts with the women. It
Hello.
starts there. And if the women are well, the children thrive too.
Right.
Yeah.
How you gonna say you love the kids if you don't love the mama?
Listen, but the intention behind what I want to put forth is truly just so people can have a space where they don't feel judged or feel uncomfortable. They know that I can be me here.
Yeah.
I can be me here. Whatever being me looks like, I can be that. One of the mantras I've really begun to live by in the last 6 7 months is I love you, but I love me more.
Yeah.
And that, and also I've moved away from saying I'm just going to be selfish for today. Like, no, I'm just going to take care of me today. That's not selfish.
I'm taking care of me.
Because the truth is, what good am I to anybody if I'm dead?
Right.
And part of part of creating that continuum of care, that wraparound care, is also, I don't want to say teaching people how to care for themselves, but reminding them to care for themselves.
Mm-hmm.
Because you would never, a lot of people would never think about, oh, I should probably go get this done. Or there's a standard schedule that people go to the dentist or go to the optometrist or something. You know, it's a reminder. It's a reminder.
Simba, remember.
No, seriously, remember who you are. Remember who you are.
You,
It's nothing. Remember who you are. And I can truly say that, like, having my brother is a kidney transplant recipient. He got his transplant this May. And while this is something that we were hoping for, praying for, and we're glad that he's gotten, I really paid attention to and dialed into how he's really shifted how he lives life.
mm-hmm.
Um, everything is different. How he approaches it, his relationship with food is different. How his relationship with fitness is different. How his everything, there's been a complete paradigm shift. Um, just to how he approaches the life, and he's the eldest of the three of us. I have two older siblings, it's three of us total. So we've lost a sibling, so it's just him and I left. And having lost a brother, and also watching him like truly transform, is like, no, I don't want to have to go through all that
Mm-hmm.
to have this whole new outlook on life. But let me start with me, simple stuff. If that
Yeah.
just means taking an extra 10 minutes in the shower, or um, going for a longer walk, or just walking, period. Or sometimes get comfortable with just doing nothing.
Right.
And one of the things that I have to remind myself daily is what you're doing is enough. Your day does not have to be filled with things, activity. Sometimes doing nothing is enough.
Yes.
It's fine.
Yes.
It's okay. I really just want us to all feel soft.
I
I
like that.
just want us to be soft.
I'm hugging right now.
Yeah, I just want to, just be
Yeah.
soft. Like I really reached that point, and I can't really pinpoint what has gotten me here.
Mm-hmm.
I don't, I've seen a lot of loss. Like my brother passed at 36. I had a really good friend that passed at 40. I had another really good friend that passed at 32. And so when you start to see people, you see, we all know that life is short, but when it's that close,
Yeah.
it's like I was telling my brother maybe a year ago, my older brother said, you know, I'm excited to be in my 30s, but I'm afraid of 36.
Mm-hmm.
That's scary.
Yeah. Yeah.
Why? So I was like, my brother died at 36. Like, I mean, I still have to get there. I was like, you were
Right.
past that at that point. And he was like, I understand that. But I think that's also why I've truly adapted that mantra of I love you, but I love me more. My brother was stressed.
Mm.
He was tired, overworked, underpaid, doing all the things as a parent, as a husband, doing all the things. And so stress kills. And I'm just not interested in seeing what that looks like. I miss my brother dearly, but I don't want to see him yet.
I will see you later.
Not exactly. I got some
Much
time.
later. Much later.
Exactly. Much later.
Yeah.
I only got 102 years in me. I really think I can do that. I think that's feasible.
Yeah. Yeah. Hello.
I am excited to see and the wheels have been turning, the ball has been rolling. I've connected with a lot of people
Yeah.
who are of the same train of thought as me. Literally just yesterday, had a conversation with someone from Georgia State about creating this directory, this hub of of a directory, and allowing people to connect with who they need to connect with, um, as a means of making sure that we don't have any lapses in care where we know that they feel from, okay, this is their LGBTQ plus affirming, they're this affirming, they're that,
Yeah.
That's the goal. I want everybody to feel supported. And I think in a lot of ways we tend to try to show up for people in the way that we want people to show up for us. And so perhaps this is just an iteration of that for me. But I know that this is what I want to see in the community and in healthcare.
Yeah.
Maybe we can not change history, but we can shift the trajectory of history to where
Right.
we don't have to be afraid to go into healthcare spaces to be seen about, because eventually we'll get to the point where we know this is cool, this is safe.
Yes. Like it is possible, probable,
Yeah,
and we have the skills to live in a different world. We can do this
yeah,
differently. We
exactly.
can do this differently.
Pure equity. Pure equity. That's the goal here.
Well, thank you so much, Aeryka, for joining us. And I'll catch you in the next one.